Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. So we have 3 patients in this compilation video. Thank you so much for all your feedback on the last video, saying that you enjoyed seeing the tools. And a couple of people asked if they could see some of the other tools we use in relation to different sizes. What I'm going to do, I'm going to explain that bit here. But I'm also going to put some chapter marks in the video. So if you're really not that interested in the tools and you want to go straight to the wax, there'll be a chapter mark which will take you straight to it, which is just at the timeline at the bottom there. So we showed you the fine end last time, which is this one here. And lots of people say they couldn't get over how small it was. But in relation to the standard size Zollner tube that we use, this is the standard size Zollner tube here, which is really difficult to get into focus. Put my hand behind it. There you go. You can just about see it there. So if I try and put these two next door to one another, you can see that the fine end is just ever so slightly thinner. If you look at the end of it, which I will try and do that, there you go. Let's try to go. Oh god, this is backwards, there we go. So you can see that fine end is just ever so slightly thinner than the standard size on the tube, which allows us to get into much smaller spaces like the narrow ear canal you saw the other day. In this video, you're also going to see the oval Jobson horn, which is the one I showed you last time, which has got the very oval end on it, which is great for getting in and out and behind those smaller bits of wax. And you're also going to see the crocodile forceps, which is the other thing that people want to see. So this is the crocodile forceps. So you can see that it opens and shuts using a little set of handles just down this end. If I turn it around that way, it's probably a bit easier to see. There you go. So as we move the handles, you'll see you get the opening and shutting there at the end. Very fine end on here as well, which I will try and put my hand behind so you can see it. There you go. You'll see it's very, very narrow on the end there. There you go. So that's the tools we're going to be using in today's video. Somebody did ask if they could see the endoscope as well, which isn't a problem. So here is the endoscope. So this is what I use to look into people's ears. So you have a little screen on the back here, which shows what I'm seeing through the endoscope, which is at the very end there. So to give you some idea of the end, it's really difficult. It's trying to get into focus. There we go. So you can see this little bit at the end. This is the endoscope, this section here, okay? And then this bit is where we mount the camera, so you can see on the back. This little blue bit you can see at the bottom is basically a battery pack, which allows us to get the light, which we shine into people's ears. So we've got a very, very bright light, and we can see exactly what's on the screen there. So what you're seeing inside the patient's ear, really, you're not going in too deep. We're only going about that far in, so not too deep into the patient's ear with the endoscope in most cases. Yeah, so that's what we use to do our filming. So, if you're just joining us now, if you've missed the last bit, you go straight to the wax bit. We're going to do the wax video for you now. So I'm just going to pop my glasses on so I can see again. And then if I click here, and there we go, it should pop up on the screen. There we are. Okay. So as I said, there are 3 patients in this compilation. This first patient came through very, very sort of squishy wax in a ring around the outside, but I can see that just that little bit further in the wax looks a lot drier. You can actually see as we get a grip on it there. This is the standard size Zollner tube, okay, so the larger of the Zollner tubes. We just managed to get a grip on it there just to hold on to the edge, lifting and pulling away from the canal wall. As you lift, you can see that wax is actually quite dry, and you can see this sort of layer of dry skin underneath. So we're trying to get a good grip on this to hold on to it. When you have dry skin issues like this and the wax really firmly attaches to the canal wall, it can sometimes be really difficult to pull that out using suction, because the skin and the fact the wax is dried onto the canal walls is all holding this in. So what I'm trying to do is loosen this outside edge, because if it stays as one piece and we can get the whole thing loosened, obviously the whole thing will come out in one piece. But looking at what I can see here, you can see it's really difficult to try and peel all this away. You don't have a lot of room in there as far as that wax, between the wax and the canal wall, if you like. So we're just getting rid of a lot of the outer debris. Obviously, if we're trying to pull this central section of wax forwards, then that outer debris is going to hold it all in place and stop it from coming away. You can see I'm trying. There we are. Did you see a little bit of movement to it then? As we got a grip, it started to move, which means we've loosened it from the canal walls. But you can see these sort of harder pieces at the front here are really kind of just holding it all into place. So I'm going to try again now just to hold on to this one side, because that's where we got the bit of movement last time. give it a bit of a wiggle. But because of the hard and uneven texture on the face of this wax, it's really difficult to get a good suction grip. So we're going to use the oval Jobson horn now, which I just showed you. So this little tool here. So we're just going in now over the top of the wax. Now you remember I said it's got this angled end on there. So we're trying to find a gap to get over the top of the wax with that little angled beveled end you can see there, to try and get over the top to bring it forwards. There you go. We just managed to get a little bit rolled towards me, which has created another gap. I'm just going to try and get behind that. There you go. The whole thing's starting to come away now. There we are. You can see that much darker wax at the rear end of that block, and then that lighter coloured wax at the front. I actually filmed this in our other clinic. I didn't have any rulers with me, so somebody asked if they could see it in relation to the size of my hand, which fortunately I'd already done. So you can see it's quite hard. You've got that sort of white skin texture around the outside there, which has come away from it. But yeah, quite a solid little piece, that one. Patient very relieved to get that out. So this is the second patient in our compilation. You can see as soon as you look at that wax, you can see it looks very, very different. Much wetter. There's a sheen to the outside, which would indicate to me that the patient is, first of all, the wax is slightly softer, and that the patient has been using some form of softening drop. Usually when you get that sheen on it, it's usually a bit of olive oil that they've used on there. So we've got the standard size ulnar tube in here again now, just slowly working our way at the front. You can see it's a relatively narrow ear canal. We've gone from that kind of rounder to a more oval shaped canal. So we are getting the ulnar tube. We can just about accommodate it to get into that ear canal there. Just slowly lifting the wax up, wiggling it back and forth just to try and pull this out a little bit. Slowly working. Now we're trying to roll it from the top. It's got kind of wedged at the entrance to the canal, so we're going to use the oval Jobson horn again, which is the one I showed you earlier. So we're just trying to go over the top again, trying to pull forwards with this. You can see it started to pull away and got a little bit stuck. It got so far out of the canal, but then there was also a sort of tail leading to another section. So we've obviously got this piece of dry skin underneath, which is connecting the front and back ends of these two pieces of wax here. So as I'm pulling on the one side, it's not releasing the front section of wax, but it's drawing the rear section further down. So I'm trying to go over the top and trying to pull that rear section using that little bit of dry skin, which is why it's wiggling in the camera a little bit there. You can see that little bit of skin there. You can see the moisture that we've released as well. With moving that block forward, suddenly you get a little moisture coming. That's what's misting the camera there. There we are. We've got behind it now with the Jobson horn. As we lift this up, you'll see you had that front section or rear section, this little skinny bit of dry skin in between holding the two together. You can see some remnants of it there to the right-hand side. So we're just going to use the suction tube just to get rid of that. There we go. And you can also see that there was quite a long, sort of thick hair in there as well. So we're just going to use the crocodile forceps just to grab that. The suction tube would be not really much use in trying to get hold of something like this. There's a little bit of hair. Just because if you imagine you've got a very, very thin hair and you're putting a wide suction tube against it, it's just not going to get the suction grip there. You can see the eardrum, a little bit of dullness to the eardrum. We haven't got that really pronounced light reflex we normally have there. So we've got, well, to be very accurate, 15/16 of an inch. We're looking at about 2.5 centimetres there. So just under an inch long and just over 2.5 centimetres. You can see it was embedded quite a way down. So this is the last patient in the compilation. More of an unusual type of wax. You can see that kind of spiral effect there where it's kind of wrapping around the canal wall. A little bit of dry skin in there as well. Very dry wax. You can see that instantly because it's got this sort of very pale yellow colour to it around the edges and this sort of deeper honey colour in the middle. So you get this very dry, thin layer of wax which is formed to the canal wall. Don't forget the skin forms sort of laterally and the wax moves out of the canal, so it's just kind of got this almost a spiral effect to it. What I'm trying to do here is I've got the standard size ulnar tube in here, so I'm lifting from the canal wall. The keen-eyed among you might have seen that there was a little gap in the middle of the wax, but this was the patient's problem with this one, is when their jaw was moving, the canal was changing shape like this. So it was opening and closing that gap up. And what you can see now is we've cleared the front third of the canal. But can you see that spiral? We go from the ceiling, the roof of the canal, all the way around down to the eardrum, this long spiral. Very careful now we have to be. If we push at the top of this wax and push into it too far, what will happen is, because of the nature of this type of wax, it'll push that rear section, which is sitting just in front of the eardrum, right up against the drum. So it can be quite uncomfortable. So I'm trying to work on the front section, pull that off the ceiling, because it's very sticky and tacky, this type of wax. So pull it down from the ceiling of the canal there, and then draw it forward at the same time. You can see how it's stretching and you're pulling as it comes away from the canal there. Always difficult when you've got a very thin layer. You can you see what I mean about it moving if you start touching it? So what I'm gently doing is it's just teasing it off the canal there, trying to pull enough of a flap away that we can get a grip either with the suction or with another tool if we need to. So you can see that very thin honey layer. Of course, we pulled that away now, so we've got the crocodile forceps in here, just slowly trying to get a grip, holding on to it. Now sometimes it'll shear because it can be quite dry and brittle as it comes away. It depends on how well that's formed, and that's exactly what's happening here. As we've got it to the outer part of the ear canal, because the canal entrance is quite narrow and the inner part of the ear canal is a little bit wider, that corkscrew shape is caught on the outside, so it's just sheared the front off. We've got the rest off there. You can see it looks nice and healthy. Eardrum's looking good, good light reflex, hammer bone's really visible there, good colour. So this is the same patient now, but the second ear. So you can see a very similar effect here. Lots of wax in that kind of spiral effect in there as well. So we'll start off using the same tools, using the standard size. So I gotta have a drink, my throat's going dry. The standard size on the tube in here, just to pull the top down. Carry on without me a second. That's better. Okay, so we're pulling this top section down. Slowly bringing it out now. There you go. You can see. Can you see about that kind of honey color to it? That really light color. It's very thin on the outside edge. Watch as we start peeling this section away. You can see it's kind of really dry and crumbly. Now that's the really dry sections of this wax, and then you've got this slightly thicker. It starts off as quite a sticky wax. So it really sticks to the canal wall, and then the stickiness comes from the dryness of the wax, the very slight dryness there. That forms that sticky nature, and then as it sticks to the canal wall, it dries and really hardens to this kind of plate effect here. Difficult when you have lots of angular pieces, because as we said with the hair earlier, it's very difficult to get that out using the normal suction. But when you've got these very angular pieces, the same thing, it's difficult to get a grip on. So we're going to use the crocodile forceps again. But it's just, if you look at it, can you see it's just that little bit too soft and brittle there. So as we get a grip, we're not getting to the really harder, sort of tougher pieces of wax to hold on to. There you go, you can see it moving slightly. Trying to detach it from the canal wall. Don't forget, the canal walls are sensitive. You've got to be really careful when you're working this close to a canal wall, because if you accidentally sort of push into it with the side of the Zollner tube, you do run the risk of a little bit of bleeding, and it's really uncomfortable for the patient. And that is paramount in what you're doing. You need to make this as comfortable as you possibly can for your patient. You must always remember it's another person sat there, and they if it's uncomfortable, it's not going to be a nice experience for them. Bless them. Okay, so you've got a good grip there with the crocodile forceps. We pulled the side in, got a good grip. It held together really nicely. That came away really lovely. Bit deeper in there, just grab that next section. You can see now where they're a bit freer. They're not sticking, to the canal walls. So they are coming away really, really well. And there we are. There's the eardrum there, looking nice and healthy. So this is what we removed. So what's that, an inch and... inch and a half. Can I go for inch and a half on that one, or maybe just over? I'm going to go for inch and a half, and just under 4 centimeters. So yeah, so you can see we had lots of. Let me flip back here. Let me tip the glasses off as Lots and lots of very different types of wax in there. We had a couple of the harder sections, but you can see how when the wax is that little bit harder, it can vary quite a lot between the texture of the wax. So you saw that between the first video and the last video there, the first video, the wax was rock hard. You know, it was almost like a little pebble, like a little stone, because it had dried out so much. When you saw the last video there, where you had that very sticky type of wax that was stuck to the canal wall, that had also started drying, but it hadn't dried out enough to turn it into what you saw in the first video. So you get these kind of stages of wax dryness sometimes, you know, if it's been in there a long time. Far more common, I find, if you've obviously got some dryness to the skin. We're not producing as much oil to keep that wax nice and soft and supple. Well, I hope you enjoyed the video. I hope you enjoyed seeing the tools. I'm more than happy to do that again for you if you want to see it. If you can think of anything you'd like to see in the videos, I know that a few people have said a few more sort of educational videos and stuff. I'll certainly look into trying to do that for you when I've got a bit more time. But if you can think of anything else you want to see, by all means let me know. Thank you so much for watching. Oh, if you haven't subscribed, click the subscribe button. I'd love to get to 250,000 subscribers. We're this close, that far for 250,000. So I'd love to get up to there if we possibly can. So if you haven't subscribed already, you don't mind doing so. If you could subscribe, that would be fab. And I shall see you again on Monday. Have a great weekend. Have a good time. Look after yourselves, guys. And I'll see you soon.